Welcome. This is the session, How Nonprofits Are Taking Care of Health Needs During COVID. My name is Nadine Gabai-Botero, and I'm president of Focus Fundraising. We are a consultancy here in the DC area working with national and local organizations on fundraising and building support. So I'm really excited to be here with you all. We have two great panelists. I'm going to let them introduce themselves in just a minute. Note that we are going to have time for questions at the end. So as you think of questions, please put them in the chat and we'll go through them as best we can. So with that, we're going to go ahead and get started. I'm going to throw it over to Nancy White, who'll say a little bit about her work, and thank you and welcome.
Thank you, Nadine, and hello, everybody. I'm Nancy White, and I am president of Arlington Free Clinic. And Arlington Free Clinic, for the past 26 years, has provided free comprehensive health care to low-income, uninsured Arlington residents through the generosity of volunteers and donors. And by volunteers, I mean 450 volunteers, everyone from interpreters to neurosurgeons to the medical assistant that I met this afternoon who said, when I was a little girl, you helped my mom, and so I'm back to volunteering. So it's a really community project to take care of people in a model that I think is the model for how I'd like my healthcare to be, and how I hope the future of healthcare would be, to have all under one roof: dentists, physicians, mental health providers, physical therapists, even exercise and nutrition all in one place, and to do that in a really collaborative environment through the generosity also of donors like all of you.
It's wonderful.
And I'm going to turn things over to Annalise and pass it on to my friend from up the street. Happy to see you.
Thank you, Nancy. Hello, everybody. My name is Annalise Quinn, and I'm the very proud executive director of Culmore Clinic. And I'm here with very, very clear ringing in my ears from Terry O'Hara Lavoy, who is the co-founder of Culmore Clinic, who said, always remember, Arlington Free Clinic is the mothership. We have learned so much from our partnership with Arlington Free Clinic, and so it's just an honor to be here today with Nancy. So Culmore Clinic is a very small, part-time, nonprofit health clinic that's based in the extremely rich diversity, rich linguistically, culturally community of Baileys and Culmore. Despite this incredible richness, it's considered one of the islands of disadvantage, as has been described by the Northern Virginia Health Foundation. And, we serve a community that is largely a newcomer community, people who are low, very, very low income. Most of them are under 200% of the federal poverty line. And many of them are illiterate even in their own languages. So we have had to accommodate that in many ways. Like the Arlington Free Clinic, we have a wonderful free clinic model of a very small core paid staff and a plethora of volunteers. We have about 70 volunteers currently supporting us, and like in Arlington Free Clinic, we have our interpreters, we have physicians, we have nurses, we have nurse practitioners, we have counselors, and then we also have logistical support for whether it's setting outdoor activities such as medication pickup or COVID testing and that sort of thing. So
great. Well, thank you, both of you. Love hearing about your work. So I want to just dive in and talk a little bit. Obviously, COVID is the #1 health concern across the board, but how has it impacted the health of your clients in other ways? Have you seen, for instance, delayed checkups, more sedentary lifestyle? What are sort of the ramifications that you're seeing?
So yes to all of that. But I think that the thing that keeps me up at night is mental health, that most of our patients lost their jobs in the first weeks of the pandemic. And not only were they already struggling with chronic health conditions, very often multiple health conditions, but to suddenly lose their income when their lives were so fragile already, and then to have COVID on top of that. One of our young adult male patients, 25 years old, I'll call him Jerome, told us about continuing to work at a restaurant, and he caught COVID, and he was trying to support his family, went back home and stayed at home, and 3 of his family members caught COVID, and 1 of them died. And he was, there he is responsible for trying to help his family, but at the same time dealing with that, and came to us for mental health support. And that's like, that's one of many stories, and you peel the onion back and everybody's got a story like that. And it was really hard to meet the mental health needs before COVID, but it is just, the floodgates are open, and it's just, it's really hard to know how to support those individuals. It's a tough time.
Mm-hmm. Mm-hmm. And Lise, anything to add there from your perspective?
Yeah, I just as Nancy says, the mental stress that so many of our patients are under right now, they have been most exposed, disproportionately exposed to COVID, because they tend to work in the community. I don't know how people define emergency workers, but these days, but certainly they've been out delivering groceries and doing street cleaning, and just been exposed on a day-to-day level. So they also live in living conditions where we found that when we were delivering food and medications to people in their homes, because were trying to isolate, we discovered that there would be maybe 4 or 5 people in a room, and maybe 2 rooms and 2 different families. And, I can only imagine what it must have been like trying to isolate in a situation like that. So there's so much stress. And then on top of that, of course, there's the lack of access to some of the resources that sometimes are a challenge accessing anyway. Things like if one of our patients needs to see a nephrologist or an oncologist, prior to COVID, that could have been a bit of a challenge for us to try and organize for them. But during COVID, it became next to impossible. So some of our patients that had these kind of chronic illnesses were really struggling.
Wow. You've sort of answered the question I was about to ask. So I'm going to move to, tell me about how your clinics and you have been balancing sort of needing to provide the services that are so urgent with COVID, for you, for your doctors and other medical and other support staff.
Well, as I told my staff the other day, because almost all of our care is provided by volunteers, I said, if we have a volunteer come to the clinic to see patients and they don't feel protected, and somebody gets sick, it's like, that's our care for our patients. And we have to be so careful to protect our staff, but also protect our volunteers and our patients. We went to almost fully remote work, as I think Annalise did from the beginning, seeing only those people who really needed to come in. But managing a telehealth call for our patients compared to what I do when I talk to my doctor and I just flip open my computer and I click on a button. So we'll have a retired physician on a 25-year-old MacBook Pro out in McLean. We'll have an interpreter in 7 corners in Falls Church on another call. We'll have a patient in the bathroom at work trying to find a private place for a call. We'll have a nurse here. We'll have 4 or 5 people on the call trying to make this work. And we've got to have an interpreter in Spanish for the 2:00 call, an interpreter in Amharic for the 3:00 call, an interpreter in Mongolian for the 4:00 call. And we're doing 70 calls a week.
Wow.
At least of those with that complexity. But so we can't wait to get back face to face. But it's the way the cases are going, it looks like we're going to be doing at least a hybrid of this for quite some time.
Mm-hmm.
Yes, we're exactly the same. We went straight into telemedicine mode on March 17th when we had to close our physical doors, because we're actually located within an incredible church, First Christian Church in Falls Church, but they were closing the doors and we also had to. And also a lot of our volunteers are retired, and at the time we felt very vulnerable. So we also understood that, they wanted to stay engaged, but they just didn't feel comfortable coming into the clinic, except for these cases where patients has had to be seen. And sometimes it was for something like just to be able to help them with a insulin pen, because they didn't know how to read instructions in Spanish or English or, other languages. So they just needed to visually see it. And we have, certainly our providers have got to the point where they said, that we need to start seeing some of our patients again. And so we have worked on a hybrid model now of telemedicine, which, just as Nancy says, extremely challenging. We find that with a lot of our patients, they live in areas they don't even have good bandwidth. They don't even have Wi-Fi. So sometimes, they're the connection is really bad. So there's this plethora of telemedicine platforms out there, but we end up doing WhatsApp, because, it's just so challenging. And then, as Nancy says, it's, we think that we have clinic from 10 to 2, but finding patients, getting through to patients, connecting with everyone, it takes a long time. But we're ready to start in December. We're going to start on site again, 1 day a week. And we have done a full infectious disease plan, prevention plan, should I say. And so we're developing patient pods that will be unique spaces for patients, which is a little different than we did it in the past. So we're, keeping our fingers crossed that will enable us to start being able to see patients on site and in person, because that's what a lot of them just want,
And need too. Sometimes that's just
yeah.
So I want to, looking ahead and feeling optimistic, when COVID is over, or at least very much receded, what do you think will remain as elements of your practice that were put into place for COVID? What do you think is going to continue?
I think that I hope that some aspects of telehealth will stay. I think certain things have to happen for that to occur, but it's so convenient for certain physician specialties to be able to dial into a call for someone, or for chronic care rechecks, instead of having people take a day off from work to come in to check. And so I think that there's a real possibility, assuming that we deal with some of the issues related to the digital divide. It's internet access to reliable devices, the knowledge and tech literacy to be able to use the devices, to be able to download forms, to enroll in services that, people, poor people are used to going to places with papers and waiting to sign up for stuff. It's like they can't do that anymore, but they don't have the ability to sign up online. And so that needs to be fixed first. But I do think that there's a lot of potential for telehealth and the safety net if we can address some of that.
Yes, I think we're exactly the same. Telehealth has worked, and for the most part, it's worked. But despite the challenges, one of the things that has been interesting is that, we know that there are a number of social determinants of health, and we know that some of the problems people have in accessing is, transportation or childcare or other things like that. And so, we find that if we've started internally discussing whether or not we have to just change the hours that we do our services to our patients, because, sometimes it's easier for them to maybe, do have a visit at home if their kid is sick and they just don't want to leave them, or they just can't get in, their spouse or partner has got the car and they just can't make it. And, we hope that we can use it in a robust and rather flexible way to, to ensure that our patients can get the care, and it works a little bit more in their schedule, because, I'm sure this is the same for Nancy. Our patients work 1, 2, 3 jobs a day. And, I sometimes just even driving here today and going down Culmore, Bailey's Crossroads, and, I was stopped at a light and I just looked at so many of the people, just, the day laborers waiting for somebody to come pick them up and give them a job, or the lady at the bus stop getting a bus and not knowing, is she going to home? Is she going to another job? Is she going off to clean? And then thinking, gosh, that's what we're here for. We are there so that at least healthcare is not an issue for them to stress about. We are here for them. So it's a good feeling, but a lot more has to be done for sure.
It's really about providing that safety net. Really, I think we all understand what a safety net is now, much more than we ever have, whether it's financial or health, medical. But I think the flexibility that we've all experienced in some way or another, for a lot of people, it's that, work-life balance or what have you. I don't think we're going to lose, hopefully, with the good parts about that flexibility. I want to just say as an aside, I happen to have tried to do a telemed appointment with my doctor today to arrange a COVID test because I was out celebrating on Saturday on Black Lives Matter Plaza. I couldn't get it to work. And this is the third time we've tried to do it. We have great internet here, but I'm just saying, like, it's just the technology in general. So somebody's going to make a lot of money doing that, I think.
Yeah.
Okay, so getting back and looking ahead now towards a potential vaccine, tell me what you think clinics in general, or your clinics, should or could play. What role in terms of disseminating the vaccine, and if it's good, let's say it's two shots, like what role do you think you'll play?
So I'm really excited to answer this because it's gonna have to be such a coordinated effort. And we had calls yesterday with Arlington County to talk about the purchase and acquisition of the freezers that we're going to need to be a vaccine distribution for our patients and for our staff, and probably for our volunteers as well. Beginning as quickly as possible. So it's going to be it's going to be critical that all of the community partners come together to reach particularly these hard, underserved areas. And I think that also along those lines, that free clinics tend to be trusted partners because we're not government, we're not a big hospital building, we're not, you don't have to fill out a lot of government forms and all of that. So I think our patients know us, and I think we can be a reliable source of information to encourage people once a good vaccine is in place. We're actually doing a flu vaccination clinic model right now that we've just sort of as a pilot to test how we might do the COVID. And we've done about 350 flu shots in a safe way, working people through various safe stations. And so we're getting set up for that. And I think we're going to be really happy to be part of the county efforts on that front.
Wonderful. And Lise, will you all join that effort? What's your clinic's role?
Yeah, so we have a medical director who's been watching the development of the vaccine situation, and I absolutely agree with everything that Nancy has said, and maybe just add that I think that one thing we can all do together is advocate that when those vaccines become available, they're free and they're accessible. So many medications are just so expensive, and certainly the population that we're serving at this at Culmore Clinic has been disproportionately impacted by COVID. As I said earlier, they're out and about, they're in living conditions, we're living on top of each other, and they are just exposed. And right today, I was on a county meeting with the health department, and they were saying it's going up again, and it's going up in the community that we serve. So it's obviously we want it to be safe. We want to make sure that there's no guinea pigs going on here where we're testing everything out, and our patients will have to decide if that's what they want, and I'm sure most of them will want it, but it's got to be free, it's got to be accessible. I mean, really and truly, this is too serious.
Yeah, absolutely. Well, I'm looking at the time and just got a note that we are heading back to the main stage. So I just want to thank you both. It's been an incredible conversation. Really loved hearing your insights, and I know I'm sure everyone who joined us did as well. We're going to the main stage. We're going to hear some quick advice on how to get more engaged locally, if you're feeling inspired, which I hope you are, and some reflections on the evening. So if you could join us, please join us at the main stage. And thank you both. Really, really great to get to know you.
Thank you.
Thank you,
everybody.
Thanks.